Nisha ji, how it has brought, this course has brought a change in you?
Thank you, ma'am. Ma'am, I would like to define two Nishas. First one, which was before these 15 days course, when an infertility patient used to come to me, I used to think, yes, this couple is infertile due to some reason. I'm going to help them with the best of my knowledge. But at the same time, I also used to think that I can do I can do little to this couple, because definitely that holistic knowledge was not there, and I used to feel that they are infertile due to some reason. That is a nature's call. I can do something, but I don't know what I can do. Now I know that that knowledge was missing on my part, and that was giving me less confidence to deal with such patients. The Nisha after this 15 days knows that as soon as a patient comes to me, I know how to evaluate that person, how to take the history of that person, how to investigate such couple, how to deal with male and female partners separately, and not only emphasize on the female partner only. How to look at minutest of details, like even if it is the viscosity of semen, which I never used to look at. Then what is the role of vitality, motility, morphology, relevance it has in my practice. Then how to proceed for protocols of controlled ovarian hyperstimulation in various patients, and when to perform IUI, when to go for timed intercourse, and when I have to see that the biological clock is ticking for them, and to counsel them and fasten their process and lead them to the IVF center. Also, ma'am, knowing the part of embryology was an eye-opener for me. Few things we witness as miracle in life. The procedure of ICSI, where I witnessed sperm being injected into ovum, was one of the miraculous things for me, which science has done, and I was devoid of this thing. And I feel very sorry about this, that after having been trained from post-graduation program, then getting senior residency from such an excellent institute, still I was lacking in this knowledge. And
No, you could not conceptualize.
Yes.
आपने जब तक देखा ही नहीं तो आप सोच ही नहीं सकते कि ये क्या हो रहा है.
Yes, ma'am. And at the same time, I also feel, ma'am, that our medical system needs to update itself a lot, because these things, opening our eyes after we get training, then definitely we are not, then definitely we cannot perform confidently in our practice. Moreover, ma'am, the colleagues around us, they don't direct us, because everyone is directionless. They are aimless because they are not being mentored. And I feel very much obliged towards you. You are, ma'am, one of a kind. You have mentored us so beautifully. Having knowledge is one thing, and imparting the same wisdom in your fellows is another thing. And ma'am, you remarkably achieved this. Along with you, ma'am, there were definitely some beautiful persons I witnessed through this journey. Ma'am, Mr. Rajneesh Kumar Sehgal, sir, he had this quality of being humble, being crystal clear in speech, and telling you things at very basic level. Then, ma'am, there were few things which my family members and my friend circle used to ask. Ma'am, my sister-in-law asked, Bhabhi, I don't want to conceive right now. Everyone is pressurizing me too much. What's the problem in preserving my ovaries? And I was not having knowledge, and I said, it is not a good idea to do so. But now, that was definitely because I was lacking in that knowledge to assist her or to tell her what are the recent advances. But there were many problems which we face, which the questions we deal with, like thalassemia couple, what to do. There are few scopes of IVF beyond infertility, which we came to know about. Then there were bottleneck areas where we used to think what to do, what not to do, like poor ovarian reserve, endometriosis, adenomyosis, azoospermia. We now know that there is an approach towards it, and there's an evidence-based approach towards it. So we have evidence-based guidelines also. We have exposure to all the infertility experts, what they are doing it, how they are customizing these protocols, and how they are applying the knowledge of the recent studies in their practice. So we also get to know that it is an evolving branch. There is nothing cut to cut. You have to got that basic principle clear about the infertility in your head, and then there is scope of evolution as well, and there are many recent advances going on in this branch. So in and all, it was a very enriching experience, not only in clearing our basics, but also leaving a scope to evolve to the best of us.
I think great. Thank you very much. I'm asking a last question, and which I want each one of you should answer me. Can you hear me?
Yes, ma'am.
Okay. What is it is that, the second week we expose you to the lot of people. Dr. Vaid, Dr. Yogi Jyoti are part of it. आप भी मुझे बताइए कि हम एक्सपोज करते हैं डॉक्टर अरुणा को, डॉक्टर मलिक को, डॉक्टर अरोड़ा को, डॉक्टर शिवानी को, and how do you feel? You think they add on to your knowledge or they confuse you?
No, ma'am. There was no confusion. Though at one point of time I felt that this was too much for my brain to handle, but then this was required because this gives us a scope of, this gives an idea to us that we have to broaden our horizon. It is not it. We have to evolve. So this was required, ma'am. This is the conditioning we require.
This is, I think, this directly or indirectly opens you up also to those people, and you have an access to them. I was wondering whether, it's good to expose them, or I've been doing it for last 2 years. Many faculty people are getting up, chipping up, and, but I was just wanting to your, opinion about it, that we continue the same practice and or we modify it.
Yes, ma'am. It's a good practice, ma'am. It is definitely not at all confusing. It opens up to us to so many people who are also practicing in the same field. So they can also share their experience, and they were very, very good at. Those sessions were really nice and very informative, and all the mentors were very, very humble in clearing all our concepts. They gave answers to all our queries as well. So, ma'am, वो तो अच्छा है. Like it was very nice.
That is right. Good. So I think we come to close. Malti ji, DJ. ये आपके डिजिटल सर्टिफिकेट्स हैं, एंड डिजिटल सर्टिफिकेट की अपनी यूटिलिटी है. You can always have your certificate with us anytime you decide about it. Physically, you can have those certificates. Okay? Nisha ji, congratulations.
Thank you, ma'am.
Zara, you can see here. These are all diploma is here. Am I clear?
Yes, ma'am.
All right. Rajeshwari is not here, but this is congratulations to you, Madam Rajeshwari. Richa, congratulations.
Thank you, ma'am.
Vinita ji, I wish you great good luck. I think, once your responsibilities of children is almost getting over, you should start thinking of a newer areas for yourself. Next one.
Thank you, ma'am.
Shweta ji, congratulations.
Thank you, ma'am.
Zara, you have a great future, and हर चीज के पीछे भागना नहीं है. पहले कुछ चीज को कंसोलिडेट करो, फिर आगे बढ़ो, फिर कंसोलिडेट करो, फिर आगे बढ़ो. ठीक है?
Yes, ma'am.
Congratulations to you, Dr. Sweta, again.
Thank you, ma'am.
Rajeshwari, congratulations. Congratulations, Vinita ji.
Thank you, ma'am.
Nisha, congratulations.
Thank you, ma'am.
Madam Zara Ansari, congratulations.
Thank you, ma'am.
Richa ji, embryology is great area, and I think you have had a full exposure. Next one.
Yes, ma'am.